My name is Hayat, and I'm a CHW and NPHI. I'm gonna introduce Dr. Regina Phillips. Dr. Regina Phillips, she and her is a co-founder of Cross-Cultural Community Services and Chief Operations Officer. Dr. Phillips has previously worked for the Westbrook School Department and the City of Portland Social Service Division, directing the Refugee Service and Family Shelter Program, and at both the University of New England and Southern Maine as an adjunct professor. She has initiated, served, and shared countless committees to address the social determinant of health. Dr. Phillips grew up in Maine and has a Master of Social Work degree from UNE and a Doctor of Social Work at Tulane University. And also, Dr. Phillips helped me a lot in Portland when she was in Portland Social Service Division. Welcome, Dr. Regina Phillips.
Oh my gosh, thank you so much. That was awesome. I really appreciate that that welcome. I'm so happy to be here with you. This is great. Public Health Week. It's just one of those things that we need to continue to talk about because it is like Alex was saying, it is such a big issue and such a big topic. One that we need to look at not only within all of our systems, but one that is going to take lifetime for us to kind of move the needle. I really appreciate, I was so glad I was here with Alex, and because I still call it MEJIP. I hope that folks still call it MEJIP. It's just got a catchy, it's just catchy. And there's so many folks, amazing and wonderful folks that work at MEJIP, and I don't know how we would get a lot of the things that we're doing in the state done without the advocacy and the activism from MEJIP. And so we don't work with, but we were part of the main care stuff when it got the oral health and main care. And so we were working with Kathy Kilrain Del Rio, who is another champion in the state for a lot of different things. So I'm not sure where to start. Maybe where I'll start is maybe I'll tell you a little bit about cross-cultural community services and what we do, because we really try to focus on the social determinants of health. So within cross-cultural community services, there's kind of two arms. I always say there's always two arms to the organization, or there is two arms to the organization. One arm is we do anti-racism, equity, diversity, inclusion training. You cannot do this work unless you are educated and have some knowledge about not only what's happening in Maine, but what is happening across this country. And again, I'm so glad that Alex is here and she did that amazing presentation, because this is all about empowerment. And so I really love the graph that you show. It's about empowering people to be an advocate and an activist where it comes, especially to Brown and Black people, because we could talk all day about the various dysfunction within systems, but within healthcare, I'm not sure if it's more dysfunctional than any other system, but it is certainly the one where for Brown and Black folks, it really affects us internally. And by that, I guess I don't mean internally, but it really affects our health. And so within certain health diseases or illnesses, Black people are between 20 and 50% more susceptible to disease and illness than our white counterparts. And that is something that we truly need to focus on. So anyway, so we concentrate on anti-racism. We do equity, diversity, and inclusion training. We talk about the refugee and immigrant community. We talk about the history of race. We talk about white privilege and white supremacy culture. This country was built on a white supremacy culture. So we often tell people we're not calling you a white supremacist, but we do need to go back in history and realize that the folks that put together the policies and the procedures that we're all trying to change and revise were put together and are still put together on a white supremacy culture. So anyway, so that's one side of the house. The other side of the house at cross-cultural is to talk about and deal with the social determinants of health. We talk a lot about oral health because a lot of times within the Black community, we are doing so much. We're worried about COVID. We're worried about diabetes. We're worried about what we're feeding our children. We're worried about their education. We're worried about housing, right? Alex was saying a lot of this. It's about all of those systems. We're so worried about all that. Sometimes oral health is number 15 or number 20, right? Because we have all of these other things we're struggling with. And so we have a concentration on oral health. We also have a concentration on behavioral health because all of this fits into a behavioral health model, right? Because everything kind of fits smoothly under behavioral health. Because if we're not well, then we can't take care of our children, we can't take care of our families, and we can't take care of ourselves. And then the third thing that we focus on is our aging population. We do not do a great job in the state or in this country in taking care of our aging population at all. And I know a lot within the Black community and within the refugee and immigrant community, our parents stay with us. Right. I mean, I have to take care of my parents. I mean, we have certain folks that come in. My father's 88. My mother's 88. My father's 92. Right. Even though they don't live with me, I have responsibility, right, to make sure that that they're being cared for. I think some of you know, or hopefully all of you know, that within Cross-Cultural Community Services, I'm just one of the co-founders. Abir Abraham, who some of you may know, she is from Sudan. She is also a co-founder, and her mom lives with her. So she has to take care of her mom. And her mom doesn't speak English. And so she has to be that advocate for her mom. And then our other co-founder, I'm sure that everybody knows, is Daka Dalak, who is from Somalia. She was the first Muslim American mayor in the state, some say in the country. And she's one of 2 or 3 folks up in the State House right now who is Muslim American and fighting and advocating for, all of those things for us in the state. So that's us. And so just to kind of give you a brief history on me, I've been a social work my whole career. I've worked on housing, I've worked on education, I've worked on employment, I've worked on, you name it, on healthcare, I've worked on all of those things. And so that, we can pay attention to what's going on, for ourselves in healthcare. Oh, thank you. Thank you. So I'm just going to stop there. I've given you a lot of information so far. I don't know if anybody has any particular questions regarding what we do, what I work, or just a question in general about public health. And how do we tackle this thing called public health or the social determinants of health? Oh, sorry. My phone.
I know my colleagues Hayat and Gracia have prepared some questions for you. So I
Yep.
will give the floor for them to ask you those questions. And anybody else in the room, please feel free to also raise your hand or put it in the chat and we can read those questions to Regina as well.
And before you get started, this is really supposed to be, like Alex said, interactive. If you have a question or a comment, or you even have more information than I do, I really hope that we can actually have a conversation. Again, I'm so glad that Alex was here because I also, I left out one small little tiny thing that I actually do, which is call I'm on the city council in Portland. Just a small little thing I left out. And so when Alex is talking about reaching out to your local folks, your folks on the city council, we hear from a lot of people. Right? People send me emails all the time and they're like, I have to advocate for my neighborhood. I have to advocate for this particular issue. I have to advocate. And so you might as well contact your local official as well and reach out, especially if there's something going on within your community. Right now in Portland, I think, and across the state, correct me if I'm wrong, anybody on this call, we're dealing with new budgets. So we're dealing with the school budget, we're dealing with the city budget, and that's the time for people to reach out to say, hold on a second, have you thought about this? Or have you thought about that, right? And so it's really important. If you don't know your elected official in your city or your town, contact them, contact them. I would also encourage you, if you are empowered enough, run for office. Run for office. We need more Black people in this state and in our towns and cities fighting for us. So anyway, so I'll stop there because I just keep talking, right? I just keep talking. So sorry.
And I think I just wanted to say before the questions start coming in, the reason why I wanted to have this platform and the two incredible speakers that we have today is so that we can know how to better ask our representatives and council members. We, like, even mainstream Americans don't know how to access that, how to go about asking questions. And for folks that we support here with our organization, New Mainers, they have a lot of concerns, but they don't know how to or which avenue to go to ask these questions. And by empowering community health workers and people that are in the community to support our folks is one way we're showing up to this space. So if we can get the information from you and Alex, whether it's an email, whether it's a person of contact or a phone call, and kind of an avenue as to how to ask these questions, would be really great. And I think one question, I'm just gonna read it off and lead you with that. Can you share any successful example of initiatives or programs aimed at improving the health outcomes of minority population in Maine?
Yeah, I can think of several successful examples, or maybe just examples of what's happening, I think, in the state. So one, Salam and I sit on the Office of Population Health Equity Advisory Council. And the HEAC is what we call it. That is really looking at public health. It's also looking at systems. It's specifically looking at state systems and diversity, equity, inclusion work and public health. It's looking at all of that. It's out of the CDC and the state of Maine. Many of you know Ian Yaffe. He was the director, and now we have a new director, Eden Silverthorne, who's leading that work. Oh, and is Hebo still on? And the wonderful Abdi Karim, it works for the CDC, who's leading a lot of this work. He's doing an amazing job at the CDC. Anyway, I think it's successful because there is several of us across the state, probably 10 to 15 of us across the state, that are really looking at the system, because Alex was talking about the system. We need to tackle the system, right? And we need to tackle it from all aspects of it. Right. And so we do a lot of training. And so what we're constantly telling people is, we're going to give you the training, but this is not where your work ends. If you really want to look at system, you need to change your mission. You need to look at your vision statement. You need to look at your hiring practices. You need to look at your promotions within your organizations. You need to look at your board and how your board is going to change, because in order to do that, that's how organizations are going to be able to build trust within the communities of color, in order for us to come in and empower us to talk about what we need to talk about or do the work that we need to do, right? It's really hard to build trust within the communities. And so we need to have organizations put all of that together. I'm a visual learner, so I need that part of a plan. I need for somebody to say to me, Regina, we're going to look at all of these things as opposed to a one and done. And as we do that work, you're going to be able to see that we're real serious about having or empowering you to come in and tell us either not necessarily what we're doing wrong, but what we can do a little bit better or a little bit differently in order to have conversations with communities of color. And it's not that we're just going to hire one person. It's not like we're going to look at our hiring practices and go, okay, well, we have that token Black. No. You're going to look at everything across your entire system, right? And so I'll give you an example. So cross-cultural community services for the long time, it was me, Declan, and Beer, right? You know, the three of us, we've known each other for a really long time, when I say a long time, I'm saying I've known them for a long time. And so it was the three of us. And so, we were cruising along, and we're putting together our employee handbook, and it's like, okay, we have to make sure we pay attention to the Christian holidays, and then we have to make sure we pay attention to the Muslim holidays, and Eid and Ramadan, and all this other stuff. Well, we just recently hired somebody who was Jewish, and they were like, so, like, what about me? And we were like, oh, right, yes, what about you? You deserve the same respect that we deserve, right? And so what we had to do was, and this is the work that we do every day, right? But it wasn't anything that was, that we were thinking about. So what we had to do is we had to change our policies and say that we're going to give out 2 kind of days in the year for folks to just go ahead and use those 2 days, not vacation days, not sick days, but 2 days within the year, so that you can go ahead and use them for whatever you need to use them, right? And so there's a simple example on how we, again, folks that are doing this work every day, had to change our policies and procedures because we hired somebody who was Jewish. And we needed to respect her religion, just like we were expecting ours. And so those are some of the policies and procedures that we need to look at. So people say, when I go into this organization, I feel heard. So that's, so I just combined 2 things that I don't know if I was supposed to combine. Now I feel like I'm all over the place. I'm sorry if I'm being really too confusing, but anyway, so the Office of Population Health Equity is a really good example of collaborating, putting people together, looking at systems and that kind of thing. Cross-cultural is a good example of what happens on an organization level and looking at your policies and procedures. And we're not saying that you have to open up your book and read, because some organizations have like 100 pages of their policy and procedures. We're not saying you have to do that. We're just saying if something comes up and you notice it and then change it. Alex has her hand up.
Sorry, I didn't mean to interrupt you at
No,
all.
no,
Just,
go ahead. You're
I
good.
was realizing that I don't think I did a great job of using like as many tangible examples as I'd like. And so I'm unfortunately going to throw this back to you, but I'm curious if there's like one social or structural determinant of health, like an example that you have, because I think sometimes that gets also like we use that jargon a lot and amongst friends, I think we can, but I'm also trying to think about like, how do I help people visualize, like, what is that, right? What's an issue we can talk about? And then how did you, within your organization work to address it? Or how are you addressing it on an ongoing basis? If you have an example, I'd love to learn about it.
Yeah, we have 2 examples. So we do a lot of work with oral health. We've been working within oral health for about the last 2.5 years. And so what we did was we put together an oral health equity collaborative. We have 3 goals out of the oral health collaborative. And so not only that, but we have a grant that we're working there. We have 5 subcontracts under the grant because we said if we're going to do this work and get paid for it, then we're going to help other organizations do this work and they also should get paid for it. And so we have 5 folks under that subcontract. And then we were very I don't know, very strategic on who we put on the Oral Health Equity Collaborative. And so we wanted local stakes because we primarily work in Greater Portland. And so we wanted Greater Portland folks, but we also needed Cumberland County folks. So we work with Cumberland County Public Health, Liz Blackwell Moore, because she gives the county view. Excuse me. And then we have some state folks from the CDC. Kate Christensen, her job is specifically oral health. And so we do a lot with training. We do a lot with relationship building. And so we're trying to figure out how we can have or how we can increase the relationship between the community and oral health practitioners. We're doing the same thing with our aging population. With our aging population, we went at it a little differently. We did some focus groups and talked to folks in the community and said, what do you need? How can we help? And they gave us a list. We created it's called the Achieving Health Equity with Older Persons, because we want to achieve this with them, not for them or to them. We have some goals in there to decrease isolation. And also to, again, increase the relationship between healthcare providers and the community. And that's the big thing. It's all about relationship building and collaboration. Because if you don't have a good relationship with anybody, if you don't have a good relationship with your school, if you don't have a good relationship with your teachers, if you don't have a good relationship with your healthcare provider, then why would you go and see them? Like, why would you reach out to them and ask them for assistance? So I hope I answered your question. And there's all kinds of other examples of success. I mean, I think about Maine Access Immigrant Network. I think about you guys. New Mainers Public Health Initiative. I think about you guys. You're constantly in the community, and you guys have employed community health workers, and you're the go-between between the community and the and healthcare. We didn't have that 10 years ago, right? I mean, I was running the Refugee Services Program. We didn't have that. I think it was just starting to come about. And that's really important because this healthcare system, and even when you break it down to oral health, or if you break it down to pediatric health of your kids or whatever, it's really overwhelming and it's really confusing. And so it's really good to have somebody who can, explain that and help you answer questions about how you can talk to your doctor or your dentist about either pain or just things in general.
Thank you, Regina. I just wanted to point out a really important message that you just said about we go to the community and we ask them, what do you need? I feel like not a lot of that is going on. You know, the state gets some kind of data from somewhere that shows the needs, and quite often the solutions are not what the community is ready to receive or is wanting at that moment. So I really appreciate your work into emphasizing the conversation that is necessary to be had with the community, and first having that intentional outreach and really taking the time to have the conversation for the community to tell us what the need is. And though that is more work for people that have been involved in community need-led assessments or focus groups and kind of discussions like that, not just one need comes out of that discussion. Usually it's a slew of things that are competing needs. So even though it's more work to find the need that route, I think it's necessary to be able to have that space and give the voice to the community so that we can make meaningful change.
No, and one of the things I want to pick up from what you said, it's data, right? And so we don't own our own data. Right? Because we've never been asked to own our own data. We are working on another successful thing that we're working on is a community-led needs assessment where we decide what we're going to ask our community. We hold the data. The data is going to come to us and then we'll share it with you. But what we have now is, and people, let me just tell you, there's umpteen thousand people at the state agencies and beyond that are reaching out to us saying, hey, we want to do a listening session in the community. Right? Yeah, ownership of data, it's major, right? Because then they control the narrative, right? I mean, and the state, I know we're running out of time, and the state controls this really well because they go, oh, we have your information. Thank you for sharing it with us. And we'll figure out how to solve that for you. We have the money and we'll figure out how to solve it for you. And so we don't need for you to sit around our table. We can figure this out because we've already collected your information, and that's the thing that we need to change, and that helps with the community-led needs assessment. Yep.
And I think you touched upon it as well when you talked about the oral health work that you're doing, your organization is doing, and recognizing that it takes a team, it takes a village to address that need. And you're recognizing not only the work that is needed to do that, but the resources those other organizations need to support the work that you're doing. And I really appreciate and want to give you a nod to that, to make sure you're building capacity with those that you're working with, because as you mentioned, we are boots on the ground, we are connected with the community, and we do get a lot of those messages saying, you know, we want to be able to have those listening sessions, but recognizing the effort and the energy that goes into leading those sessions is important. So, I mean, how do you, one last question, I guess, and then we can move on. How do you hold that strong within your organization when people are approaching you to present to you those kind of work opportunities? How do you preserve your capacity within your organization while also moving the needle and making sure that the work is done?
Yeah, it's a great question. And so we want to make sure that, well, we work with a lot of folks. It's really important for us to collaborate with a lot of different organizations. And if there's an organization out there that, you know, we feel like is not genuine, then we won't work with them. Geez, see, now I just lost all train of thought. My God, what a time to lose all train of thought. Oh my God. So what was the question again? I'm so sorry. This is what happens when you're old.
No, it's okay. It's kind of a long-winded question, and I hoping you can hear me because I see my screen is frozen.
I
But
can.
I just wanted to tell you and ask you, how do you protect your
yeah.
organization's resource, energy, time, and your staff's also energy and capacity while you're also invested in such important work? You have the desire, the passion to keep the work moving while maintaining that for your staff and your organization.
Yeah, you know what? And the word I loved you used there was investment, right? Because it's an investment. So when we are thinking about collaborating with somebody, we need to know that they're serious about equity, diversity, and inclusion, and changing and changing policies and procedures. So we're not going to just have somebody contact us and go, "Hey, we want all of your intellectual property," and then we're going to go away. Yeah, it doesn't work like that. You need to tell us how you're going to work within our communities, because CrossCulture is putting their name on that. We're putting our name on that, right? And so we're being genuine and transparent by saying, hey, we're going to work with you, right? We need to know what this is going to look like across the board. What is the final product? What's that end product? Because if it's just that you're connecting with us because you want to you want us to help you bring folks around the table and tell you about this and that, that's not us. What are we going to do collectively? Right? What is your long-term plan to gain this information and then do something with it? So for example, we were working with this organization who had a contract with the CDC to look at prenatal and to look at prenatal care and the care of new mothers, right? And so it's like, okay, we can certainly do that. We wrote a report together, and now we're trying to find the funding to figure out how we can continue those conversations, because especially within the refugee and immigrant community, we have folks coming over here who are new moms and they're pregnant, and they're going to a doctor, and the doctor is saying, you have to have this particular test so we can find out what's going on with your baby so you can decide whether you want to have an abortion or not. And mothers, especially immigrant moms, they go, excuse me, like, what did you just say? And that's why you guys' work is so important, because you are the ones who can say, you can refuse whatever kind of test you want. You don't have to take it, that kind of thing. So anyway, that's just an example of, we were like, okay, we will allow you into our communities. We will allow you to talk to the folks in our community. We're going to be there when you talk to those folks in the community. We're going to be there when you write the reports. And we're also going to be there to try to figure out how we collectively can come together to solve this issue.
Thank you so much. This was a really amazing discussion from both you and Alex to really learn a little bit about the system and how it works from kind of a broader view. And I know myself, I am continuously educating myself about how to be more engaged and how to understand the political readings. And I am forever grateful for working with Alex and Kathy to always decipher those messages for those of us. So I really appreciate that. And I know we're kind of moving along our agenda a little bit, so we're just gonna shift a little bit. And rather than going to our breakout session, we are going to move to our third presentation from my wonderful CHWs. So incredibly proud of them to be alongside of them moving this work in civic engagement. And I wanted to kind of give them a spot to shine the work that they've done as CHWs and how we involve ourselves in civic engagement and how we empower our community. So I will have Gracia share your screen, and I will give the floor to Hayat and Gracia.
Thank you, Salam. Thank you for giving everyone. So I'll start by sharing my screen. Sorry for any inconvenience. So today, my colleague Ayat and bring some how CSW can help community members in civic engagement.
Community health workers play a vital role in promoting civic engagement within communities.
Yeah. So I will say community health workers serve as a vital link between policies and community. So they educate community members on the importance of civic engagement and empower them to speak up for themselves. So it's a crucial and very important for CHW to encourage community members to involve and strive for desired results. So through community health workers approach, members we support, we will be able to understand why they must and be active when it comes to raising their voice for positive change.
Prioritizing community well-being. As the CHWs, our primary focus is the well-being of the people we serve. We advocate for the community with policymakers to ensure their voices are heard.
So my role as a community, or our role as a community health workers, or our top priority is the well-being of the community we support. So the public health initiative we work on, and we together with the effort of community health workers aim to promote health and well-being within the community members. So by combining civic engagement with public health initiative, so we can create a powerful for change among us. So CHW will work to ensure that underserved communities have access to healthcare and social resources. CHW will play the role of advocacy or role for their clients in communicating and lobbying with policymakers. So I will say in other words, as a CHW, I can act as a bridge between policymakers and the community members to ensure that their voices are heard and remove barriers to access the policymakers. So either when it comes to provide interpretation, transportation, or to prompt the community to share the testimonies, to sign in some petition, to stay informed of upcoming hearing dates, to show them the results of past hearing and action to take in supporting certain bill.
Empowering community members. Workshops are conducted to teach the fundamentals of the American system and empower individuals to advocate for their causes.
So in these slides, you can see our community members are together, and it's law and are not the same as where we came from. So it's very crucial to teach the basic of American law through workshops that will help immigrants understand their rights and responsibilities. So teaching the fundamental of American law will not only empower our people, the immigrants, so with a good knowledge, but it's also going to help them build them with, it's also going to help us build a strong community. THW will train, so we take a training and train back the community. So we can use tools like a social media, so door-to-door outreach, or connect to the mosque and to church leaders, some places like stores, or some place where humans always gather like a pantry. And at those places, we can teach them using posters, flyers, and some other tools like as a teaching material.
Sharing stories and advocacy. CHW will teach community members how to effectively share their stories to support the passage of important bills. Every voice counts in the journey towards justice.
Okay, so I will say that sometimes people have stories to tell, but they don't know how to explain or to tell their story. As a community health workers, I will build myself with that tool to help community members tell their story and in supporting certain bills. It's always important to hear the testimonies from people who has been directly impacted, and this is another way of making a change.
Access to decision-making. CHW will confidently inform community members about lobbying efforts and public hearings, facilitating their access to decision-making process.
So this is another role that CHW can play, like a lobbying and public hearing are vital in shaping the policy that affect our communities. So as a CHW, I'm committed to keeping the community informed of all upcoming and important events. I will send emails, posters on social media, and provide information on the website. So in addition, CSW will organize some meeting where community members can learn about issues and have their voice heard.
CHWs will join forces with other organizations that share the vision of improving civic conditions for members of their communities and standing up for positive change.
So CSW will advocate with other advocacy groups, so to affect positive change by bringing strength together and the ideas, so they can ensure that their voice are heard by a large group of people. So we have been involved for many years in some advocacy group with other mainstreaming agencies, and from this that was very helpful for our clients. And we also involve all community members on some lobbying, so like some public hearing and stuff like that.
Outreach for change. CHW, we conduct outreach and recruit community leaders from diverse backgrounds and integrate them into the larger team. Community leaders will be trained on how to effectively engage in advocacy and be a voice for change.
Okay, so we will conduct some outreach. So on the outreach, we identify potential leaders from the community who are passionate about change and have leadership record willingness. So direct contacts will be made with potential leaders via phone, email, or face-to-face meetings. So the goal on the mission of the leadership group will be explained clearly in a way that everyone can understand and bring an idea for change. CHW will follow up potential leaders to sustain interest and address any needs.
LD 199. Healthcare is a human right. many immigrants don't have access to Medicare coverage.
So this is one of the bill that we've been working, like I will say, like today our advocacy group has been involved since in lobbying in supporting LD 199, because we all know that healthcare is a human right, and as an immigrant myself and someone who has been directly impacted by the lack of health insurance, I've been involved in the advocacy group for almost than 2 years to support this bill that will give access to Medicare to everyone, regardless of the immigration status. I believe that healthcare is a human right, and we all deserve to have access to health insurance when it's needed.
Speaking up against injustice. The one who remains silent in the face of injustice is guilty, is a French proverb.
Okay, so I'll say it's like we always need to go outside there and raise a voice for change. As you can see, we've been involved in advocacy work with other partner for so many years, because we know that we cannot remain silent when things are not working. We have to go and stand up together with community members for change. Thank you very much for taking this time to listen to our short presentation. I don't know if you have any question for us. We are ready to listen, and if you have also any contribution, why not? Thank you.
Thank you so much.
Thank you so much, Hayat and Gracia, for this wonderful representation of how you have been involved in civic engagement and how you have been empowering your community as well as yourself. So I'm proud to be your colleague, and amazing to see your work shine through. I guess I have one question for both of you. If you could tell us one thing that has impacted you in your work while you are advocating for your community members in the leadership team meeting, something that has impacted you as you work to navigate the American law, as you said, which is different than from the ones that we come from in all parts of the world.
Yeah, I can go first. So from all the advocacy work that I've been doing since almost 2 years now, I would say something that impacted me is the opportunity that has been given to me to share my own testimony in supporting LD 199. That was a very great thing that I did. Although the bill didn't pass, but I was proud of myself because it gives me the opportunity to speak loud, because new miners are facing so many challenges when it comes to healthcare. So it only takes somebody who went through that to speak loud on behalf of others. And I will say I won't give up until that thing happen. So it impacted me a lot because it gives me the opportunity to speak loud, or not only for myself, but for the people that are just behind me, the clients I'm supporting. For somebody who have diabetes, who have no access to medical insurance, who have no access to insulin, you don't know how that thing is very hard. But that opportunity that has given me to lobby and to speak to legislators about my own experience was very a positive impact on me. Thank you.
Me, I can ask and speak on, on the American law. She spoke about the LD 199. I'm speaking about the immigration issue that we have. Our new miners, they don't have a what is it called in studies on their immigration. They are waiting for so long to get their paperwork and change, or the study change. We advocate. Sometimes we have some clients to come to see us, and we advocate for them. Even to fill out the immigration papers is a what is it called? Is a big issue. And I'm very, very glad to be a CHW and learning CHW's what the CHW is, because helping people is part of me. I can say that. Thank you so much.
Thank you so much, Gracia.
Thank you. Yeah, Zaki, I have a question.
Yeah, I just wanted to hop on really quick to say that, you know, especially with what both Gracia and Hayat mentioned, of even though the LD 199 bill didn't pass, and a lot of these things are slow moving and they go through multiple different iterations, it's so important to feel like you're a part of that process. And that's what's so incredible about working together with Maine Equal Justice and all of the incredible work that Alex has done, and even Dr. Regina and cross-cultural, everything that you guys do, feeling connected to the work as a community health worker is something that's completely understated. And I wanted to say that I'm just glad to be a part of this community with all of you guys, and happy to see, you know, and hear about all of the different amazing work that everyone's been up to. So yeah, that's my little 2 cents, but please, Salam, you can continue.
Thank you so much, Zakia. And I think in our work, we have talked about how for new Mainers, you know, it's not a common political topics, and getting involved in policy is not common. And more than that, actually, we steer kind of clear from it. So for folks to really have the knowledge and saying that if you do want to change something within your city, within your state, as Alex had mentioned earlier, as small as what you see in the park, it is, you have a voice and you have opportunity to be able to speak to your representatives and your city council to make that change happen. And even with us spreading that message, it is still, there's a hesitancy to approach and to talk about those really important things. And for some of us, when we're having these convenings of leadership team meetings, there are other needs that come up, even though we are here to address one need, which is perfectly fine. I think as we gain knowledge of how we can then raise a voice to make possibly new bills to being presented. And one thing that I learned actually for myself this year is that well, I guess last year, it's only April, that every bill gets a day in the sun, I guess, for the lack of better terms. Every bill is presented and every bill is heard, which is kind of new to me. And so any bill that we deem necessary to present, we can present, when it's incredible to have that opportunity in the state of Maine. So we will love your support, and as we engage with the community, as we engage with our leaders and our legislators, to continue to support our effort by showing up to our events and kind of staying connected with us. And we will reach out to Dr. Regina and Alex as a touchstone for us as well as we navigating the system, and we continue to look up to you guys, steering us correctly as we are empowering ourselves as well as our community. As you saw being presented to you, our work as CHWs and how we engage and how we are an advocate for our community members, I wanted to kind of give an opportunity for both of you as our guest speakers to see if you can tell us a little bit more about how we can do more, essentially, right? This is the perfect opportunity, how you guys can tell us how we can reach out to more of the organizations that you partner with, or your own organization, how CHWs can have a bigger impact.
Would you like to go first, Dr. Phillips, or would you like me to go first?
You go right ahead. Thank you.
Well, now of course I'm like, oh, what am I? Okay, I think maybe a simple ask and in a community organizing model would be each of you that have a network of people, right, that may be impacted. Let's use the lack of access to main care for immigrants, since we're using that as an example, a campaign we're working on. If each of you talked to one or two other people in your life, right, that may be impacted or interested in getting involved, and then those people talk to one or two more people, right, that's one model of community organizing. That's how we expand our outreach. So we all don't have to do everything. In fact, we can't, right? Like, we need each other. And we can't, you know, we have to be a little humble too about like a single human being or a single organization is not going to be able to solve a problem on our own or overnight. And so I think particularly with this campaign, what we've realized, right, is that we need allies. Yes, we want directly impacted people, but we need allies outside of the immigrant community to care about this issue, to realize that everyone having access to healthcare means everybody is better off, right? Whether or not you have healthcare right now, like if I don't have kids, but let's pretend I do, you know, if my child is going to school with a child who doesn't have access to healthcare, who can't get seen when they're sick, who can't have a vaccine, my child is now impacted by that child, right? Like, so even if you don't care, which you should, that human beings have healthcare, right? We're connected, we're in community. COVID, right? We learned this, like we are all interconnected. So I would like, I would like us all to commit to that. You know, let's think about 1 to 2 people in our lives that we can bring into this movement and into this campaign and say, healthcare is a human right. It also impacts all of us. This is the bare minimum of what people deserve to be dignified, full human beings, is to have access to healthcare. And here's one thing you could do. You could write an email to this person. You could call them and leave them a voicemail. You could email Alex and ask when the next, meeting is. You could talk to a community member who doesn't have healthcare and ask them if they would like to be involved in a campaign, or if you could use their story confidentially and with their full consent to demonstrate why this is a problem. So yeah, I would say let's commit to that. All of us is going to talk to at least one person about the need for immigrant access to healthcare in Maine and all across this country, and that in that way we can build this movement. Thank you.
Yeah, that was perfect. Thanks, Alex. No, that was great. That was absolutely great. To kind of piggyback on what you say, use and abuse your local officials. I'm a local official. And so when I say that, I say use and abuse, not necessarily me, but use and abuse me. Because once you collaborate, like Alex was saying, once you talk to that one person and that person talks to another person and that person talks to another person, you have a collaboration, you have a coalition, right? And so to move it forward, you need, and the other thing that Alex mentioned is allies. You need Black allies and you need white allies, right? We live in a state where we're 94% white. Right. And so for us to think that we can do all of this work on our own within the Black communities, then we're not seeing the full picture. We have to have our white allies. I mean, and just to kind of piggyback on that a little bit, my sister, Rachel Talbot Ross, was in the legislature. She was all by herself, right? She was all by herself. She had her in the House, and it was her and Craig Hickman. Craig Hickman represented was right outside of Augusta. So it was the two of them, right? Now, just 2 years ago, look at how many people of color are now at the State House. You have Jill Duson, who represents Portland, who's in the Senate. You have Mana, who is from Bangor. You have Decca, who's from South Portland. And you have, oh my God. Who's from Lewiston? You guys know who's from Lewiston. What is her name? Who's the representative in Lewiston who's Muslim?
Mana.
So who's the person in Bangor? Sorry, Mana's in, right.
Umbreen.
Thank you. Geez, I'm getting my legislators all confused. Isn't that awful? And they're all people of color. Anyway, right. And so look at that. That has totally, yes, Umbreen, who's absolutely fabulous, and Ambrina's in Bangor. So just look at that diversity right there. Reach out to your local officials, right? And the other thing is, even though I represent Portland, I could reach out to somebody in Biddeford as a local official. I can reach out to somebody who is in wherever to just say, let's have a conversation about that, right? And that's what we're there for. And believe you me, we're getting emails and phone calls from folks who are asking me that they need lights in their park. I swear to God. They need their trash picked up, right? So I'm getting these emails, and everybody on the city council is getting those emails from folks that need some assistance. And public health is huge. It's absolutely huge. So, for me, I would say with the community health outworkers, first of all, you guys are doing an amazing and incredible job. Keep up the good work. And if you need an ally from local officials, please reach out to them, because that's what they're there for.
Thank you so, so much. From the bottom of our hearts, NPHI thanks you for all the partnership that we've had in the past, and we will for sure have in the future. And thank you so much for dedicating your time to be here with us and for kicking off our week-long celebration. I truly appreciate both of you. And thank you for Hayat and Gracia for the wonderful presentation. You continue to shine, and amazing CHWs, and we are glad to have you as co-workers. So thank you so much for being here, and I hope you have a wonderful start to your week, and happy Monday to everyone.
Thank you.
Thank you so much.